Good evening. My name is ALIA SOFIAH binti AZIZ and thank you for joining us tonight on Epic News Channel. Our health segment brings attention to a growing concern in our community as an increase in reported case of hand, foot and mouth disease (Hfmd). Health Director General Dr. Muhammad Razi Abu Hassan said,
Selangor contributed the highest number of cases at 2,443 cases, or 24.9% of the total number of cases until May 13, followed by Sabah, 1,505 cases, the Federal Territories of Kuala Lumpur and Putrajaya, 977 cases, Johor, 915 cases, Sarawak, 750 cases, while other states reported around or less than 700 cases in 2023.
our reporter Aina Shafika has more on this viral infection that has been affecting both children and adults. Next, we will pass to Aina.
Thank you, Alia. Hand, foot and mouth disease or Hfmd is a viral illness that we've seen arise in locally. It's characterized by symptoms such as fever, sore throat and a distinctive rash on the hands and feet. Over the past few weeks, health officials have noted an uptick in reported cases, especially among school-aged children. The virus is known to spread through close personal contact, making schools and daycare facilities potential hotspots. Here's with me, Puan Akilah, as a local health expert, will help us in understanding hand, foot and mouth disease.
Hand, foot and mouth disease is generally a mild illness, but it can cause discomfort for those affected. Hand, foot and mouth disease is a viral infection that causes rashes or blisters on the hands and feet as well as in or around the mouth. It's crucial for parents and caregivers to be aware of the symptoms and seek medical advice if they suspect their children might have Hfmd.
So, what are the most common symptoms of Hfmd?
Okay, symptoms of the Hfmd usually include fever, rashes, mouth sores, and skin rash. The rash is commonly found in hand and feet. Hand, foot, and mouth disease is common in infants and children that are younger than 5 years old. Most children have mild symptoms for 7 to 10 days. 1 or 2 days after a fever, you might see small sores like ulcers at the throat or tonsils, some very small blisters or red spots on the palms of the hands, soles of the feet, and the diaper area.
So, how can we diagnose this disease?
Usually, healthcare providers can tell if someone has Hfmd by examining the patient within their rash appearance while considering the patient's age and other symptoms too. Sometimes, healthcare providers might collect samples from the patient throat offices, which is poop, and send them to laboratory for tests.
Usually, how is Hfmd transmitted?
Hfmd spreads easily through person-to-person contact. Droplets made when the person who's sick with Hfmd such as sneeze, cough, and coughs. It also can be transmitted by contact with contaminated surface and objects. For example, trolleys at groceries or at the playground.
So, what are the primary sources of infection?
Hfmd is caused by viruses that belong to the enterovirus family. The infection was caused by a strain of Coxsackie virus. It caused a blister-like rash, as the name implies, involved the hands, feet, and mouth.
Is there any preventive measures for individuals and parents to take to avoid contracting Hfmd?
Okay, to prevent hand, foot, and mouth disease, individuals and parents should practice good hygiene, such as frequent hand washing with soap and water. Avoid close contact with infected individuals and disinfect commonly touched surface. Encourage children to avoid sharing personal items like utensils and toys and teach them to cover their mouth and nose when coughing or sneezing. Stay informed about outbreaks in the community and follow any guideline or recommendation from health authority.
Can you explain the typical treatment approach for individuals diagnosed with Hfmd in Malaysia? Are there any specific medication or therapies recommended?
So far, there is no cure or specific treatment for HFMD. Healthcare providers will prescribe fever medicine and painkillers that will treat the fever with paracetamol or non-steroidal anti-inflammatory drugs, which also help to reduce the pain and inflammation of mouth ulcers. Take over-the-counter medication to relieve fever and pain caused by the mouth sores. These medications can include acetaminophen or ibuprofen. It is important to give the child adequate fluids during the course of illness. The infection usually resolves after 7 to 10 days when immunity develops in their body.
Thank you, Puan Akila. Now let's head back to the studio and get more insight on HFMD.
Thank you, Aina, for shedding light on this concerning development. We encourage our viewers to stay informed, practice good hygiene, and seek medical advice if needed. As always, we will continue to keep you updated on any further developments. Stay tuned to Epic News channels for the latest news and information.